For patient selection with large core, there still are some questions about what is the ideal imaging criteria for those patients, whether it's CT, whether it's CTP, whether the presence of penumbral tissue impacts those outcomes. And so these are still questions that are yet to be determined. There are studies that are looking at the already published large trials of large core infarcts, looking at the imaging criteria of each of those studies and seeing what is the best parameters for that. There are also, as I mentioned earlier, a lot of venues for neuroprotection for patients with large core, because those seem to be the ones who have the highest risk of reperfusion hemorrhage. A couple of groups have looked at the use of endovascular, cold saline infusion for local hypothermia as a method for neuroprotection for patients who suffer stroke in general, but certainly in large core populations that would be even more pertinent. So from the studies that have been published, most of the studies had a cutoff of 3 to 5 in the aspects. Very few patients were enrolled that had an aspects of 0 to 2, but even in those patients, a dedicated look at those patients showed that they still have a mortality, actually not a mortality benefit, but they do have a more likelihood of favorable outcome, even though their risk of hemorrhage is even further and even higher than patients within aspects of 3 to 5. And of course, patients within aspects of 3 to 5 seem to have a better outcome than patients with 0 to 2. So the patients in the 0 to 2 category are still a topic to be discussed and explored a little bit more.